Alright, so you folks requested a Medicare 101 video or learn more about Medicare, and in this video I'll go ahead and do a short and simple Medicare 101. So let's jump right into it. Alright everyone, so today we're going to go over a quick Medicare 101 plan for life. So for those of you folks, thank you for taking time to start this, and I'm going to go as fast and as slow as possible. All right, so today let's go over the agenda. So today we're going to cover eligibility, what Medicare is, your Medicare options, costs, important dates, and more. So choose your Medicare coverage with knowledge and confidence, and I hope that we can achieve that after we're finished with this short Medicare 101. So my name is Matthew Ragudo. I am the one speaking over this slideshow. I'm a chartered retirement planning counselor, certified long-term care planner, and I've been helping seniors locally here in Hawaii for just about 6 years with Plan Advisors Hawaii. So if you have any questions, you can send those directly to my email address here. And of course, someone will be reaching out if you had so requested someone to. All right, so Medicare eligibility. At age 65, you may be eligible for Medicare Parts A and B, even if you're still at work. So if you want to look into what Medicare can offer and you're 65, you are definitely able to. You may also be eligible for premium-free Medicare Part A through your spouse, although you must still qualify by age or disability. So an example would be if you yourself are not yet 65, but your spouse is, you as a 62-year-old would not be able to get Medicare until either you are 65 or you have a qualifying disability. And again, it says here, you may also be eligible for Medicare Parts A and B if you're under 65 and have a disability or end-stage renal disease. That's like kidney failure. All right, next we're going to go over to what is Medicare. And Medicare is the U.S. government's largest health insurance program. It serves more than 59 million people as of this recording. So most likely by the time you're watching this in 2020, it's going to be well over 60 million people. It's run by the Centers for Medicare and Medicaid Services as part of the U.S. Department of Health and Human Services. Medicare is divided into parts. Parts A and B are original Medicare. Medicare Part C is Medicare Advantage, and Part D is prescription drug coverage. So let's jump into what original Medicare is. All right, so original Medicare is offered by the federal government, and it covers much but not all of your care, and generally has a deductible and coinsurance. So as of this video recording in 2020, the Medicare Part B deductible is $198, and the coinsurance after that is going to be 20%. Medicare Part A has the Medicare hospital deductible, and that's $1,408 as of this recording. All right, so Part A covers hospitalization, skilled nursing facilities, hospice care, and home health. Part B covers the more common things like doctor's appointments, outpatient care, preventative services, occupational and physical therapy, and home health. Medicare Part C and D are different though because they are offered by private companies. Medicare Advantage Part C may include extra benefits like prescription drug coverage, and sometimes they offer things like dental, vision, and wellness programs. Part D is just a standalone drug plan, and they just cover prescription drugs. One important thing to note here, Part C, that's the Medicare Advantage, they have to cover everything that Parts A and B cover, and most of them will include prescription drugs, but make sure you check if you need prescription drugs. All right, so what are your Medicare options? Well, your Medicare options are, option 1 is original Medicare. You use that. Part A covers your hospital. Part B covers the doctors. And you will have to probably pick up a prescription drug plan unless you are in specific subgroups, like if you are retired from the Veteran Association or TRICARE, those folks have their own separate drug plan that they can be a part of, and they don't need prescription drug plans. But please check with the plan advisor who you select so that we can properly guide you in the right direction. Option 2 is original Medicare plus a Medicare Supplement insurance plan and a prescription drug plan. Option 3 is going to be Medicare Advantage plan, sometimes abbreviated to MA or MAPD if it includes a drug plan. It includes all of the services covered under Medicare Parts A and B. It often includes extra benefits like gym memberships. Some include dental and vision preventative services, and a lot of them do include the prescription drug plan. All right, and MA plans are available through private companies. So next we're going to go over the important dates. So the annual election period for Medicare Advantage plans and prescription drug plans is October 15th through December 7th. And outside of that, there's what's called a special enrollment period. And these time periods, you can only make changes to your plan due to special conditions, like moving out of your plan area, leaving an employer group plan, or qualifying for Medicaid. Now that we know pretty much what your options are, let's figure out what the questions you need to ask yourself in order to make a Medicare choice. And the first is cost. How much will you pay for premiums, deductibles, co-insurance, and co-payments? Are there additional benefits such as prescription drug coverage? Are the plans in-network providers conveniently located? Have you needed care in the past few years, and do you anticipate your medicine needs to increase? Do your doctors and preferred healthcare facilities accept the plan? So these are very important things to consider when signing up for a plan, and we always suggest you send us the answers to these questions so that we can properly make a advise you on the plan that most suits your needs. All right, so let's think about your needs. Do you have a chronic condition where your healthcare needs grow in the near future? Do you think your prescription drug spending will increase? Do you need more coverage than Medicare Parts A and B provide? Because Medicare Supplement or Medicare Advantage plans may help cover some of those unexpected costs. So when would you choose a Medicare Advantage plan instead of staying on original Medicare? So you must have both Parts A and B. You usually have to pay an additional plan premium. You may remain a Medicare member as long as you keep paying your Part B premium. Along with the Medicare Advantage plans, you may have the opportunity to purchase additional supplemental benefits like dental and vision for an additional premium. So make sure you continue paying your B premium. A lot of folks actually think that because you join the Medicare Advantage plan, you don't have to pay your Part B premium, but you do need to. You have to remain on both Part A and B of Medicare if you choose to join the Medicare Advantage plan. All right, so there's a lot of different types of Medicare Advantage plans. There's the Health Maintenance Organization, where your primary care provider provides most of the navigation for your health. Preferred Provider Organizations, or PPOs, you can choose any provider that accepts Medicare, but you may pay less for in-network services. Private fee-for-service is more freedom, but of course network arrangements may still apply. And there's special needs plans, which could extend to folks who are on Medicaid, and in certain areas if you have a qualifying chronic illness like diabetes or some kind of a heart condition, and perhaps if you are confined to a nursing home or require long-term care, some of those plans do exist. All right, so special needs plans generally offer benefits, more focused and specialized health care, and of course the formulary drug list to meet specific needs. To join an approved SMP or special needs plan, you have to have Parts A and B and at least one of the following conditions. So a chronic illness, again like diabetes or heart condition, Medicaid assistance from the state, or reside in certain types of institutions like a long-term care or a nursing home. And of course, special need plans include all of the Medicare Part A, B, and D benefits. So let's take a look at Medicare Advantage extra benefits. So Medicare Advantage plans usually include extra benefits, things like dental, vision, fitness programs that are beyond what original Medicare offers. For example, these are a lot of the things that they offer: fitness programs like membership to 24-hour fitness, vision and dental coverage, maybe a glasses benefit, and access to having your drugs delivered to you at your home. And a lot of times, like in the plans we have out here, you can access a virtual visit to speak to a doctor or a nurse 24 hours a day. So Medicare Supplement insurance plans. What or when would you need a Medigap plan? So Medigap plans are designed to help pay some of the original Medicare costs, like the co-payments, co-insurances, and deductibles. So each Medicare Supplement insurance plan has a unique blend of benefits. Medicare beneficiaries may want this type of plan because the costs over the course of a year can be a lot more predictable. And if you wanted more information on Medicare supplement plans, there's a great resource called the Medigap Buyer's Guide that comes out every year from the Center for Medicaid and Medicare and Medicaid Services. So let's keep going. Medicare Part D, that's drug coverage. Again, this one you need to purchase from a private company. So Medicare itself, unlike Parts A and B, where you can still utilize the federal program, Part D or prescription drug plans need to be purchased by a private company. And usually you can purchase Part D either from getting a standalone drug plan, or if it is incorporated or included in your Medicare Advantage plan. So if you have a Medicare Advantage plan, your drug coverage is already included in there, and you won't be able to, or you should, if you sign up for another Part D drug plan, you'll actually be kicked out of the Medicare Advantage plan because you can only have one. You can only have either a Part C or Part D drug plan. Now, if you have a Part C plan that includes Part D benefits, it's called an MAPD, and that's okay. So Medicare Part D has what's called the coverage gap or donut hole. And as of this recording in 2020, in the donut hole, you'll be paying 25% of the drug's cost, or the drug negotiated cost that the insurance company pays. All right, so these are some helpful resources: Medicare.gov, the Medicare New Handbook. Also, you can go to www.shiptalk.org, and then you can contact your state Medicaid office or the Social Security Administration. All right, so a few words about costs and choices to help you decide what's right for you. And Medicare Part D, Medicare Advantage, and Medicare Supplement insurance plans have separate premiums from original Medicare. If you want more coverage than original Medicare provides, you can choose Medicare Advantage or a prescription drug plan or a Medicare Supplement insurance plan. You can't choose all of them, only one. Now you have to select the coverage you want for the price that works for you. Your cost depends on the coverage you choose. Medicare Advantage costs depend on whether the plan charges a monthly premium or pays any of your monthly Part B premiums, and it also includes co-payments, co-insurances, or deductibles. Original Medicare and Medicare Advantage plans cover certain preventative services. Medicare Advantage plans are required to cover everything original Medicare does. And thank you. That's the end of our Medicare 101, and I hope this helps you consider your Medicare coverage choices. One thing that you need to remember is that, like any kind of a insurance product, You have to really look at what you're getting and figure out if you can live with those costs, because the major difference like between a Medicare Advantage plan and a Medicare Supplement plan is Medicare Supplement plans actually have premiums that will almost guarantee or almost definitely increase year over year. Medicare Advantage plans, especially in places that have a lot of them, the premium tends to be more stable and may offer you extra benefits as far as like dental, vision, and gym membership. So it really depends on understanding what your specific needs are, and definitely we will help you figure out what those are. And I just wanted to say that we probably can help you find a plan that's best for you. We are Medicare brokers and we have access to all the plans that are in your area that we believe can be or will be suitable for all of our clients. So, with that said, we look forward to hearing back from you. We've been able to maximize our online tools to be able to serve you, especially right now in the pandemic when everything is closed down and we can't meet. So don't worry, we can help you enroll and find the best Medicare plan for you. With that said, you guys all have a great day. God bless, and we look forward to hearing from you again. Hope you enjoyed today's video. For more resources on retirement planning topics like Medicare, Social Security, and retirement assets, be sure to subscribe and check back here from time to time for up-to-date resources on retirement planning. Thank you for watching. Have a great day and God bless.